So let us continue our talk about principles of oncology, and further we have to discuss about the techniques which are used to establish the tissue diagnosis for any carcinoma. Number one, we have fine needle aspiration cytology. In this, a very fine needle, as the name indicates, is used to aspirate a sample, and its cellular study is done by different techniques. The positive points for fine needle aspiration cytology is that it is rapid, it is least invasive, it is very accurate, but for superficial structures. There is a negative point that it cannot distinguish between an invasive carcinoma from an in situ carcinoma. Now further, we have true cut or core-needle biopsy. It can differentiate between invasive and in situ carcinoma, and this again, a needle is used to take a sample, and it is good for deeper structures, for example thyroid, lymph nodes. Then talking about incisional biopsy. Now incisional biopsy is surgical removal of the representative part which is to have carcinoma. Now further talking about excisional biopsy. In this, whole tissue is removed. It is both therapeutic as well as diagnostic. Now talking about cytological smear. It is based on the theory or the fact that the neoplastic cells are less cohesive and they are present in the fluid or secretions. So when a scraping from a surface of any organ which is being suspected to have a carcinoma, we can identify that whether there are certain cells which could be labeled as neoplastic or not. So it is a very important technique. Now further talking about certain principles of cancer surgery, and they include diagnosis and staging of carcinoma. Now this is done through laparoscopy, removal of the primary disease, and this includes a radical surgery. Now radical surgery could be removal of the tumor, and it could be adequate tumor-free margin achievement. Now removal of a tumor is one thing, and achieving tumor-free margins is another thing. There are different parameters which are kept in mind while removing a tumor. If there is a possibility of achieving tumor-free margins, then the surgery is proceeded. Otherwise, it could be left. Now further, principles of cancer surgery include removal of the metastatic disease. This is specifically important in a colorectal carcinoma patient who is most likely to have a liver met. In that case, liver resection in a colorectal carcinoma patient could save the life of the patient. And then comes the palliative treatment. This only involves the relief of the symptoms and prevention. So if the patient has been diagnosed that he or she is having a certain type of gene which makes them more susceptible of developing a carcinoma, or a certain patient has come to you with a positive family history of a specific type of carcinoma, then it is the duty of the doctor to actually perform a prophylactic surgery in that patient prior of that patient actually developing the carcinoma, because that carcinoma will worsen the life of that patient. Talking about few examples, is familial adenomatous polyposis. This is a gene. If it is found in a patient, it is highly likely that he or she may develop carcinoma of colon. So prophylactic total colectomy is performed in these patients. Then talking about another example, the BRCA mutations. If these mutations are found in a certain patient, most likely to be a female, then their breast has to be removed by a prophylactic mastectomy because they are most likely to develop carcinoma. Then comes reconstruction. Breast reconstruction is specifically done after MRM surgery, that is modified radical mastectomy. I will talk about these surgeries in detail when I talk about breast carcinoma. Now talking about a brief overview about different modalities used for treatment of a carcinoma. They include surgery, chemotherapy, radiotherapy, immunotherapy, and hormonal therapy. I will go into detail of each of them. Any certain type of treatment which is given to a patient depends upon the type, the grade, and the stage of carcinoma. So one has to be very wise in using or selecting a specific technique for a specific patient in a specific age group. First of all, talking about the chemotherapy. The chemotherapy could be used as a primary treatment, adjuvant therapy, or a neoadjuvant therapy. Using it as primary therapy means that all those carcinomas which are chemosensitive could directly be treated with a chemotherapy prior to using any other modality, and they include lymphomas, leukemias, and germ cell tumors. Now, one must differentiate between adjuvant therapy and neoadjuvant therapy. By adjuvant therapy, we mean use of a chemotherapeutic agent after primary excision of a tumor so that the tumor does not reoccur. And this is used, for example, for colorectal carcinoma. This could be used for any other carcinoma as well. And neoadjuvant therapy is the use of chemotherapeutic agent prior to a definitive treatment in order to downstage a tumor. Now, there are different classes of drugs under chemotherapy, but it is very difficult to cram them from the textbook, so I have made a table so that it will become easy for you to grasp the concept. There are 5 categories. Number 1, alkylating agent. Their mechanism of action is that they form covalent bond within the DNA and they will impede replication. The examples include cyclophosphamide, dicarbazine, ifosfamide. Their major side effects are infertility, and cyclophosphamide's specific side effect is hemorrhagic cystitis. Talking about anti-metabolites, as the name indicates, anti means opposite to the metabolism. They block the DNA synthesis by blocking the metabolic pathways, and they include methotrexate, 5-fluorouracil, gemcitabine. Their side effects include nephrotoxicity and megaloblastic anemia. Now, talking about these cytotoxic antibiotics, they prevent the cell division, and they include adriamycin, mitomycin, and bleomycin. So remember from the term bleomycin, blowing a whistle, and remember the side effect, pulmonary fibrosis or involvement of the lungs in any other means. Now, talking about the 4th and 5th category, microtubule inhibitors. Now, they will affect the microtubular functioning and eventually preventing the cell division to occur. The examples are vincristine, vinblastine, paclitaxel, docetaxel. Their side effects include autonomic neuropathy and myopathy. Then comes hormones. Now, these hormone drugs, they antagonize the hormone action which is responsible for the replication of cell, thus they will inhibit the replication. They include tamoxifen, anastrozole, leuserelin. Now, how will we assess the response to a chemotherapy? By serial measurements of the size of the tumor and tumor markers. Now, chemotherapy is prescribed over a definitive period of time, and in that duration, through serial measurement of the size of the tumor and tumor markers, the response to that chemotherapy is measured. Now, there are certain principles of using combination of chemotherapy drugs from different categories. I have already explained there are 5 different categories. So, if one needs to use 2 or more drugs from different categories, following principles must be kept in mind. Use of effective agents, the most effective agents of a specific category with different mode of actions, as they already have, they're classified because of different mode of actions, but the most important thing, they should have a non-overlapping toxicity, otherwise they will cause more harm than good. Now, talking about further complications of chemotherapy which are present in all the categories, and they include nausea and vomiting, myelosuppression, alopecia, that is loss of hair, mouth ulceration, diarrhea, and constipation. The main disadvantage of chemotherapy is selective toxicity, that a specific system will get affected, and this has to be prevented by a wise use and dosage of specific drugs in a specific patient.